One of the things I just wanted to focus on today is obviously the FDA emergency authorization for the 12 to 15-year-olds. What do you tell parents, I guess, who are skeptical? I know you've probably covered this a bunch of times, but what would you tell them for those who are hesitant about getting their adolescent vaccinated?
Yeah, I'll tell you what I'm telling my patients. This is great news. I'm very excited about this. One, I have a vaccine to offer 12 and up, and that's a large part of the population now. And our kids need to be protected. The 12, 13, and 14 and 15-year-olds I know want to go outside and play with their friends. They want to be on their sports teams. They want to stay in school and not be quarantined. That's something that they want to do. The other thing I remind them is it really protects their own personal health. A lot of 12-year-olds have underlying health conditions, asthma, obesity, some other things. So they need to be protected. And a lot of these kids have loved ones who are older. You want to protect grandma, grandpa, and the other loved ones in your life. So, if you have a child in your life who's in that 12 to 15 age group, I'd hurry up and get them vaccinated. I do emphasize the urgency there. And just so you know, my two sons are getting their Pfizer second dose today. One of the things I will just tell you as a parent is a profound sense of relief when my kids get the second dose of vaccine. It's just one less thing as a parent and as a dad I have to worry about. So I'm really looking forward to that as well.
Do you think maybe a motivation is, the socialization and being able to do, whether it's sleepovers or get-togethers with friends or more socializing?
I think one of the things we all remember about our teen years is our friends are so important to us in our teen years. They really shape who we become as an adults, but you really need to be with them to have that shaping occur. And I think socialization is going to be a motivation for a lot of people. And that's fine. I mean, I really think it's just important to accept that's what it is. It's a well-studied vaccine. This is not even new anymore. We've been at this, since December 14th with this vaccine. It's been given to over 100 million people. It's good enough for your son and daughter. It really is.
One of the things I've heard this, and I know you've been asked about this before, is the concern over adolescent girls and infertility. It would not just adolescents or teenagers, but that has come up. Let me just ask you about it one more time. What do you say to people who have raised that concern? And I know there's really no evidence of that, but what do you say to ease those fears about you never know what's going to happen years down the road?
Well, you do know what's going to happen years down the road. And sometimes it's okay to have a pun. This is an intended pun. In other words, the biological plausibility of the vaccine having a problem with someone conceiving is really inconceivable. It's really not a problem. It's nothing that anyone has to worry about. There's well-documented research at this point. There's, world experts who know this isn't a problem, and this really isn't a problem. And one of the things I just say is when you're thinking about the vaccine for your daughter, I would invite you to think about how I thought about this for my daughter, who's 19 years young. And my advice to her was, let me help get you to get the vaccine. Because you know what Sarah wanted to do? She wanted to be protected, stay in college, and she doesn't want to bring the disease home to anybody in her family. And I think those are the ways to think about it. But yeah, it's perfectly safe for women and men, and really highly encourage teenagers to go ahead and get the vaccine as soon as possible. I wanted to underscore the urgency. One of the things I think we need to be thinking about is why is the urgency? We need to get as many people vaccinated as soon as possible so we can get this disease out of our state. We're a state that really has been very fortunate with vaccine acceptance. And, we really have seen nice results so far. I'd like to see Rhode Island as a state that really gets to herd immunity first. We're on pace to do that. I'd love to see us do that. We deserve it. And quite frankly, we should do that.
Yeah, on the, a lot of people getting the vaccine. What are you seeing in the schools? Obviously you can't tell with the 12 to 15-year-olds yet, but more like that older high school crowd and vaccine acceptance from them at this point.
Yeah, we're seeing it pick up a little bit. I mean, I think one of the things we're seeing is from a state standpoint, we have changed our strategy. We're bringing the vaccine to students. We're bringing that there. And so right now, that's what we're doing. We're going to bring the vaccine to the students, and we'll see what the uptake looks like. It's a little too early to tell, but I think one of the things that you sometimes see in this age group is there's a lack of urgency because it's like, well, I'll get to it when I get to it. I have other things to do. But right now, what I encourage folks to think about is, no, this is what you have to do right now. You have to get the vaccine. Part of what I think is really important is we just need to get as much of this state fully immunized as soon as possible. It's in everyone's best interest to get this virus out of the state.
And just looking at the numbers, it's kids in that under 18 age range are now second highest in cases. Is that basically just because they're the ones who haven't been vaccinated, or are they spreading it more, or is it a combination of both?
Yeah, I think what you're going to see with the pandemic is the pandemic's going to move towards the unvaccinated population. And so the pandemic has moved into a younger age group because that's the people who aren't vaccinated. I think one of the things we have to keep in mind, though, is the virus of today is a mutated version, right? It's a variant of concern. The B117 is most common, but the virus of today is not the same virus of when this thing started. So it causes people to be sicker. And I think it's just an important concept is one of the reasons why people should pick up vaccine urgency is if you're spreading disease in 2021, you're spreading a more significant disease than was being spread in 2020. So we're seeing a lot of great success with our numbers coming down because we've got so many people being vaccinated. But we can eliminate this virus in this state, and we can eliminate it this summer if we get enough people vaccinated. And that's something I think we all want to see.
So you say eliminated for not down to zero, but for practicality's sake, you mean?
Yeah, we can get this virus eliminated in this state this summer if we all get the vaccine. In other words, if we're all willing to do that, we can drive this down to almost 0 cases per day. I really believe that's possible in our state. And what people need to do is just get the vaccine to make that happen. There might be other states who need to catch up to us, and that's their challenge, not ours. But quite frankly, I think when I look at our modeling data, I really think we can eliminate this virus in the state. It won't be eradicated. Eradicated means it's gone and won't come back. Eliminated means it's really controlled well. We have very few cases, and we're not so worried about it anymore. And that's the summer Rhode Island deserves, by the way.
Do you see, Dr. McDonald, at all that a vaccine would be required to go back to school in the fall? I mean, obviously, the kids have to get vaccinated for a bunch of other stuff before they go to school. But has that been discussed, or is that on the table?
It hasn't been discussed, and as far as I know, it's not on the table. I think right now what we want to do is get as many people signed up and vaccinated as soon as possible. I think right now we should focus on just getting the kids vaccinated who we can. I think one of the problems with vaccinating people, for the summer is it's not going to be people under 11 who are going to have an opportunity to get the vaccine. So I really don't see how it could be required for school because those kids won't be eligible. My guess is till September. And I think it really speaks that larger. So if we can get the 12 and older crowd vaccinated, we really can beat this disease down quite a bit in Rhode Island. We really can. And then the younger kids can get the vaccine when it's approved in the fall.
And do you know, and I don't know, maybe Joseph can jump in here. Do you know, are there any middle school clinics planned at this point, like they've been doing with the high schools?
I don't know off the top of my head. Joe, do you know?
Yeah, we're starting those conversations with the district. So there's nothing firm on the calendar yet, but the balls are in motion for that.
Okay, great. Well, Dr. McDonald, Joseph, thanks for your time. I appreciate it.
Yeah.
Sorry, it's been so long since I've done one of these. Glad to be.
Oh, glad to have you back. Your colleagues are a joy to talk to as well. Thank you so much for showing interest in this.
Okay. Thanks, Dr. McDonald. Thanks, Joseph.
Bye-bye.
Take it easy. Be good.